Developing news right now in the nation's capital. There was a cliffhanger in the Senate today as a critical vote was held on health care. Republicans are trying to advance plans to repeal and replace Obamacare, but the final outcome is far from certain. The Senate is moving ahead with the debate on the Obamacare overhaul after a tie-breaking vote from Vice President Mike Pence. The GOP needs nearly every Republican senator on board for any action on health care because they only hold a slim majority. Several senators said they were opposed to the bill as is, or they're on the fence. The vote to discuss the bill kicks off 20 hours of debate on amendments. The back and forth is expected to last all week long. Now, as this debate moves forward, we're learning more about what this overhaul could mean for the Ocean State. Eyewitness News reporter Steph Machado has those details live from the Providence Mobile Newsroom. Steph.
Well, as the Obamacare repeal debate moves ahead, we're talking to the local hospital association president. Teresa Paiva-Weed used to be the one making the laws. Now she's dealing with the effects of the possible federal health care overhaul and how it will impact patients and health care workers.
The vice president votes in the affirmative, and the motion is agreed to.
The vote was 51-50 to open the debate to possibly repeal the Affordable Care Act. The Senate will now debate what to replace Obamacare with, or to just straight repeal it or parts of it.
Regardless of what the proposed plan has been, there's been a consistent theme throughout the discussion, and that is there's going to be a significant decline in the number of insured.
Teresa Paiva-Weed is the president of the Hospital Association of Rhode Island.
No one is going to ever be turned away or lose care because of what is done in Washington.
The state says 100,000 Rhode Islanders got insurance under Obamacare between HealthSource RI and Medicaid expansion. Paiva-Weed's concern is what happens if they lose coverage.
If they don't have insurance, then they don't get preventative care. They show up in emergency rooms seeking emergency services because they weren't able to go see a doctor ahead of time.
The hospitals will take on the cost to care for patients anyway, and Paiva-Weed says with possible cuts to the reimbursement from Medicaid, hospital budgets could tank and layoffs for hospital employees would be on the table.
That could potentially mean a reduction in workforce.
Again, the Senate now debating this Obamacare repeal and replace plan. Frankly, a lot of the details are still unknown. Now, coming up new at 6, more reaction from our local leaders, including how the governor says this could all affect your tax bill. Live in Providence, I'm Steph Machado, Eyewitness News.